Today, we're reacting to Garand Thumb's 50 caliber explosive bullets versus torso.
Why are you here?
Great question, Professor. Interns, say it with me. Learning. Above anything else, this is an educational video, and as such, all depictions of trauma on brave ballistics gel torsos have been carefully contextualized within a lesson on human anatomy. With the help of the flannel professor, we'll cover 50 caliber projectile injuries to the torso, its underlying systems and structures in explosive detail. Garand, will you please introduce our patient?
These dummies are from Ballistic Dummy Labs, and they very meticulously put together fairly accurate representations of a human torso.
Correct. And as you'll see, they are complete with synthetic analogs for organs, blood, and bone, while the ballistics gel simulates skin and soft tissue. Of course, Professor Garand's instrument choice is a little different to what you might find in an average operating room.
The rifle we will be using is the Halo sniper rifle, brought to us by Steyr. Thank you very much.
And your typical surgical tool doesn't fire projectiles. Pew, pew, pew.
We have here a 50 cal round. Typical full metal jacket.
Obviously, that 660 grain 50 caliber slug is enormous when compared to the standard 5.56 round in the flannel professor's hand.
We'll be firing this first through the ballistic dummy to find out how a basic FMJ will perform.
Excellent, as no experiment of this type would be complete without a control projectile against which to compare our titular rounds.
So this right here is a spotter tracer round. It's used for tank ammunition in order to spot where their round would land. It has a little bit of explosive in it.
A creative application of a round not initially intended for human targets. But, as you might imagine, that small amount of tracer explosive is more than enough to disrupt the human anatomy.
And then, of course, after that, we'll be firing a Rauphus round. It's a armor-piercing incendiary combined with a slow explosive.
I'm sure you can guess which of the aforementioned rounds has the greatest destructive potential. And although any 50 caliber projectile is capable of critical damage, they are not necessarily a one-way ticket to the afterlife. During my research, I came across an article about a Marine named Corporal Jared Foster, who survived a shot from a 50 cal at point blank range. GlobeNewsWire.com explains, coming off of a night patrol, Foster was struck in the back at close range by a 50 caliber rifle bullet. The bullet went right through me from my back to my stomach. They found the round more than a mile down the road in a dirt berm, said Foster. Now, I couldn't find any information pertaining to what type of 50 caliber round Corporal Foster was hit with, but if I had to guess, I'd say a standard full metal jacket projectile, as their reinforced design is intended to retain shape upon impact for greater penetration depth, thus allowing it to pass through its unintentional friendly target. Like this. Except, unlike our ballistics gel patient, Corporal Foster was hit from behind, which may have actually worked to his advantage. Not that his position is remotely advantageous, having undergone some 45 surgeries in an attempt to regain some semblance of normal function. Let's break this down. In every projectile impact, kinetic energy is transferred from the bullet to the target. And the amount of kinetic energy transferred is determined by several factors, including the size, weight, speed, and shape of said projectile, amongst others. Upon exiting the rifle barrel, a standard full metal jacket 50 caliber round would be traveling close to its maximum velocity, and together with a projectile body designed for penetration, this would minimize the amount of time spent within the target's tissue.
But you can see it came straight through. It hardly deformed at all. you know, there was too much energy with the 50, it's too heavy or too close.
Right. A heavy, high-energy projectile designed for penetration goes in and out.
Grow up or get out.
Sure, we're talking a tiny fraction of a second, but in life or death situations, the details matter, and a projectile can only transfer energy to the target while it is in contact with said target. This transfer of kinetic energy sends a pressure wave through the tissue, creating a temporary wound cavity as they expand and leaving behind a permanent wound cavity that widens as it extends further into the body like a crude cone.
And we had that good exit. Now that did take out a good chunk of the spine,
culminating in an exit wound that is much larger than its entry counterpart. Here we can see that a portion of the spine has been crudely removed. I think this type of catastrophic spinal damage would be more likely via a frontal abdominal impact, as shown here, than an impact to the back of the body, as suffered by Corporal Foster. To put it more simply, if a bullet to the lower back misses the spine, it misses the spine.
Thanks, Doc.
As thankfully it missed Foster's. Alternatively, a bullet to the front of the abdomen that is not directly aligned with the spine, like makes contact slightly to the left of the belly button, could still cause catastrophic damage to the spine and spinal cord due to the energy transfer and small entry but large exit wound phenomenon we just talked about. Regardless, in both cases, there are many other structures that will require reconstructive surgery. And although the bullet missed his spine, Jared's list of injuries is so long, he doesn't remember all of them. He lost his tailbone completely, damaged his large and small intestines, and suffered a collapsed lung. It took a big section of my midsection out, Foster says. A closer look at our ballistics patient will shed some light on the numerous structures that could be at risk.
I mean, that's certainly a deadly wound. There's no doubt that the 50s got to it.
The spinal cord has been severely damaged with significant lateral portions of the vertebral bodies, L1 through L3, shattered completely. The most common surgeries to repair spinal fractures include spinal fusions with rods, screws, and plates, vertebroplasties, wherein the surgeon injects liquid cement into your fractured vertebrae to strengthen it, and kyphoplasties, a similar procedure that incorporates a small inflatable device to restore height to a damaged vertebrae. But wait, there isn't really a lot to restore here.
I think somebody could survive a 50 BMG.
No, not even close, dude. Look at the back.
We're looking at some combination of lumbar vertebral body replacement, or VBR, which incorporates a device designed to replace severely diseased or damaged vertebrae to restore height and alignment, as well as extensive reconstructive work to the lateral vertebral arches, which appear to be missing the entire right transverse process, pedicle, superior articular process, lamina, and spinous process. Oh boy. So, if by some miracle our patient survives, the issues present in the spine alone would take many trips to the operating room. A harrowing journey at the end of which paralysis surely awaits. Once the spinal cord has been severed, the patient will be paralyzed from the level of the injury on down.
What about the peritoneum?
What about the peritoneum? I'm glad you asked. This specialized tissue lines the abdominal wall and covers and supports most of the organs in the abdomen, while acting as a conduit for the passage of nerves, blood vessels, and lymphatics. It simply wasn't designed to withstand .50 caliber penetration, and neither were any of its contents. At this level, it is possible that the jejunum and ileum of the small intestine and transverse colon, a portion of the large intestine, have sustained damage, spilling their contents into the peritoneal cavity. Food in various stages of digestion, digestive fluid, and even stool. That is correct, yes, even poop. The transverse colon that runs horizontally across the abdomen is where the body absorbs water and salts from material that it cannot digest. Later, this becomes feces. Can you say infection and possibly slow and very painful death?
You can't
can't say that. An exploratory laparotomy, a type of open surgery of the abdomen to examine the abdominal organs, would allow the attending surgeon to determine the extent of the damage. Non-viable tissue would be removed before the identified gastrointestinal perforations are sewn shut. Patients with this type of injury, if they survive, are rewarded with the prize of a temporary and sometimes permanent stoma, where a portion of the bowel is redirected outside of the body where abdominal contents can be collected in a bag.
What does it feel like to not have an anus anymore?
And before we move, I'd like to offer a moment of silence.
All right.
For the mesenteric artery, a large blood vessel that extends vertically down into the abdomen, whose location is central enough that it may also have been caught in the line of fire. Given that a person can bleed out in about 2 minutes, an injury of this magnitude would need to occur on hospital steps to give the victim any real chance at survival. In some cases, a last-ditch technique such as Roboa may be used to temporarily maintain blood perfusion to the brain and heart while surgeons work feverishly to staunch hemorrhage from the abdomen.
A Roboa.
Roboa, or resuscitative endovascular balloon occlusion of the aorta, is a minimally invasive intervention where a balloon is deployed through an artery in the groin to a portion of the aorta above the point of hemorrhage, where it is inflated, thereby occluding blood flow further.
A Roboa will occlude the damaged artery and stop the bleeding.
And somehow, everything we've covered thus far pales in comparison to our first explosive round, tracer tank ammunition. Right. So, whenever bone is made to look like soft tissue, you're in big trouble. The rib cage could only expand like this if it was disconnected along its entire height in at least 2 places. 12 ribs aside for a total of at least 24 simultaneous fractures, assuming our dummy wasn't born with an extra rib. Yes, this does happen in rare circumstances. The point of impact here looks to be at or below the medial costal region of the right pectoral muscle, around where the floating ribs connect to the sternum, adjacent to the cartilaginous xiphoid process at the lower end of the sternum. Side note. In the section that follows, I will be referring to directions from the perspective of the patient. The projectile impacts the ribs or sternum with enough force to blow them both to freaking smithereens.
It's still smoking.
What? Oh, wow. An entry wound of that size suggests that there was a detonation upon impact, and now that the tissue was settled, we can see the extent of the damage. And well, would you believe me if I told you this is even worse than it looks? The bullet has made contact slightly above the area known as the solar plexus, towards approximately the midpoint of the body. Many vital structures converge at this point, and while a standard full metal jacket projectile with a more narrow blast radius may have avoided some of them, the explosive charge of the tracer round expanded the blast radius enough to damage all of them. Due to the trajectory of the bullet, it likely eradicated the liver, tucked away under the right costal ribs, while taking a chunk off the bottom of the right lung and the rightmost portion of the heart. Sure, your heart lies slightly behind and to the left of your sternum or the breastbone, but unfortunately, the explosive charge expanded unevenly to the left of the entry point. The upper rightmost portion of the stomach would also likely sustain damage, perhaps where the esophagus connects to it. If the wound were high enough, our patient might avoid leaking digestive acid into their open wound. But I doubt it. The large dome-shaped diaphragm muscle lining the space beneath the lungs would be damaged, impeding breathing, as well as the complex system of radiating nerves that originate from the solar plexus.
The diaphragm is like a domed thing. It's kind of a double dome, really.
And so far, that's only the front.
Oh no! Wow.
Yeah, it's bad.
Oh no is right. The fact the scapula has been cracked in half from a passing projectile beneath it illustrates the amount of force generated outwards from the path of the bullet. The exit wound indicates a slightly diagonal angle through the body, so although the bullet may not have made direct contact with the spine, the blast radius was still large enough to critically damage it, just as we hypothesized earlier on.
Yeah, there's the FMJ. there's a spot or trace around, that's pretty significant.
Side by side, the comparison is startling. What do you say, Professor? Are you comfortable making a pronouncement here in the field?
Yeah, that guy's dead. That guy's hella dead.
Unfortunately, in this case, I'd have to agree. Too many structures, most of which require immediate care, have sustained critical damage. I don't know that the conventional medical nomenclature like puncture or laceration are even sufficient here. I don't even know how much of the affected organs remain to be repaired. I don't see how it can get much worse, really.
We're gonna tape a plate to the back of this guy, see what happens.
In an attempt to contain the blast and maximize damage, I stand corrected. Well, we now know of at least one problem that duct tape can't solve.
Super strong waterproof tape!
Obviously, this shot is adding to the wound sustained in the previous impact, and it is sobering to consider that some firearms are designed to deliver multiple impacts this quickly. Take cover. I mean, what did we expect from a weapon with enough force to punch through concrete?
I can feel the heat coming out of this, dude.
Really?
Yeah, dude, it's burnt in there.
Oh, it's actually so warm.
So let me get this straight. Our patient's rib cage, the structure evolved to protect many of our most vital organs, has contained some amount of the blast within the body, effectively turning the thorax into a flash barbecue chamber. Normal internal temperature ranges between 36.5 and 37.4 degrees Celsius, and our bodies expend a lot of energy to maintain this temperature constantly. Fluctuations outside of that range are concerning. For example, a temperature of 38 degrees Celsius most often means you have a fever caused by an infection or illness. We're talking about less than 1 degree. If the core body temperature raises a few more to about 44 degrees Celsius or more, the result is almost certainly death, as everything above that temperature literally just shuts down. The temperature of the explosive round would be considerably higher than this.
Dude, it like singed. Look at that. It actually singed like the ballistic dummy on the inside.
The area where the dummy has been charred demonstrates very clearly the size of the explosive blast, extending ominously up into the chest. The entire pericardium, the fibrous sac that encases the heart, and obviously the heart within it, is burnt to a crisp, along with the good portions of the lungs and bronchi and trachea that supplies them with air. Pericardial jerky, anyone?
Look at that. Look at the back, dude. It displaced the spine. This guy now has like a curvature in his spine permanently.
Sudden, blunt force-induced scoliosis. Terrifying. And again, burnt tissue. Granted, ballistics gel is a gelatin-based solution that may char more readily than living human tissue. In a true combat scenario, I would expect a more varied composition of burn types, and the cauterization of the adjacent blood vessels caught in the blast. However, as we've already established, an organ doesn't need to burn to fail, not in the slightest.
The shotgun was bad, right? It like tore him apart. This actually rearranged like the organs on the inside.
The large-scale rearrangement of our internal organs is another thing that just doesn't fly inside the human body. We are very carefully calibrated organisms over millions of years of human evolution. The nerves and the blood vessels travel like superhighways between the organs and tissues in a super compact marvel of biological engineering. So, what if the blood intended for the liver arrives at its destination and the organ just isn't there anymore?
Like you can see it completely shifted the spine over and completely rearranged where the organs were.
And even if there was a way to reorganize the organs within the body, the aforementioned nerve and blood vessels are finite in length. Their pathways fixed and separated by various tissues.
Let's just leave it at, I want to rearrange your guts. The end.
Imagine trying to rearrange your desktop computer without untangling the wires first.
So that was the old FMJ impact, but it still split it down. You can see the lung tissue.
Someone who had sustained a blast like this would be deceased. and I hope that none of you ever stumble upon a person who has. From the comfort behind the screen, however, this vantage point provides us with an excellent view of damaged lung tissue. These organs are made of epithelial tissue, which forms the covering of all body surfaces, line body cavities and hollow organs, and are the major tissuing glands. A series of airways called bronchi branch into smaller and smaller passageways until bronchioles, the smallest of which, pass air into tiny sacs called alveoli. Many millions of alveoli in each lung, think millions of tiny balloons, amounts to spongy, delicate tissue.
That's a cavity on the inside. Look at the blast frag pattern right there. Do you see that?
Yeah, dude.
You see that streaking from the frag?
Practically speaking, the only legitimate defense against a .50 caliber round is to not get hit. Even body armor, as you'll soon see, offers very minimal defense.
So we will be firing this into the AR-500 armor right here with the dummy right here. And we're gonna see what happens.
We're stepping it up here with the Raufoss, a multi-purpose anti-material, meaning tanks, trucks, artillery, walls, high explosive, incendiary, armor-piercing ammunition projectile. Holy crap. Well, at least some of the blast was blocked by the armor. Good sign.
That's,
Oh my god.
that's straight through.
On the other hand, full penetration is a bad sign. And it didn't appear that anything exited the body. Professor Thumb, can you please confirm?
There's the... Dude, hold on. I don't see an exit wound.
Unfortunately then, there is a large, hot, slow-burning incendiary round lodged in the mediastinum, slightly to the left, from the patient's perspective, of the center line. And what organ lives in that exact location? If the heart didn't fail upon initial impact and penetration, it could easily become overheated. And while the heat from the projectile might cauterize tissue and vessels in the part of the wound channel where it comes to rest, the patient risks bleeding out via any of the structures penetrated or blood vessels severed by the projectile.
I'm pretty sure that projectile's still in him.
Well, there's only one more thing to do now then.
We're gonna tape just level 4 armor and shoot him.
Traumatic injury to the heart from a penetrating mechanism, such as a knife or gunshot, may be simple, involving, for example, a single chamber of the heart. But I'd wager this is more complex. Even though the body armor slowed the bullet significantly, the temporary and permanent cavities caused by the bullet of that size would be more than enough to disrupt multiple chambers of the myocardium muscle, along with the coronary arteries, aorta, and other nearby vessels. You may be surprised to learn that a patient who has survived a gunshot wound to the heart and arrives at the emergency department hemodynamically stable, that is, with stable blood pressure and stable heart rate, the attending surgeon may elect to treat them non-operatively. There are several case reports floating around that described rare cases like this in great detail, such as this one, submitted by Desponia Daskalaki et al. To the International Journal of Surgery Case Reports, wherein the patient was managed without retrieval of the bullet and continues to be well despite a retained intracardiac bullet. These cases are rare because penetrating cardiac trauma is often fatal before the patient even arrives at the hospital. Those who are lucky enough to arrive alive are likely to be treated with a thoracotomy, wherein an incision is made between the ribs to examine the heart and lungs or other organs present in the thorax. And if it is possible to remove the bullet without causing extra damage, it will be. If the enemy is wielding a .50 caliber rifle, I hope you have some high quality armor. Again, with that amount of explosive extending out the back of the dummy, we can envision the extent of the blast inside the thorax. Not to mention fragments of metal from the exploding round. We talked about the heart, but can we take a moment for the soft, spongy lung tissue? Internally contained blast fragments could easily cause a pneumothorax, also known as a collapsed lung, when penetrating trauma allows air to escape the lung and fill the space between the lung and the chest cavity. And a hemothorax when blood accumulates in that same space.
Yeah, I mean, what did you expect, you know? Yeah, look how clean that entrance wound is, and that exit. That's
like being punched in the chest by an anime character. The blunt force impact translated through the body armor into the torso is nothing to scoff at, especially on top of everything that we've already mentioned. As for the age-old question of whether or not a bullet has the capacity to knock a person backwards, that remains in the realm of movie magic. And the size, speed, and penetrative properties of even an explosive 50 cal round, we'll see to that. If you guys really want, we can cover shells in another video. Though I haven't seen that video yet, I'd bet on limbs flying before any significant anime knockback.
See the entrance right there. That was significant. Is there an exit? Yeah, there's an exit, but it's tiny. This thing might just have too much ass behind it.
And yet, major pericardial insult. Lungs, vessels, heart, trachea. Yikes. Professor Thumb goes on to make an excellent point. Since this is not an anti-personnel round, it is less destructive when applied directly to the ballistics dummy. So let's have a look at what happens when the Rauphus is applied in the manner for which it was designed.
Take 3.
Oh, this wound is most certainly fatal. In fact, it appears that a whole portion of the torso is now missing.
Did that take off? That took off his shoulder.
Yep.
His shoulder is gone.
Looks like the heart, lung, and many of the other structures previously discussed are also gone.
Give it to me straight, Doc.
Unfortunately, there isn't a whole lot we can do for you after an impact like this. Now you understand why most 50 caliber survival stories pertain to the extremities. Special thanks to Professor Garand for supporting our exploration of human anatomy. Remember, if you want to learn to prevent injury and move better, join me at my online gym, Human 2.0 Fitness, for free right here on YouTube. If you liked the video, be sure to comment and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.